Hi there, I'm Dr. LaQuita J, and welcome to my YouTube channel where I talk about all things in between being and becoming a pharmacist. How you doing? You all right? I am a Naplex success strategist who help pharmacists shift their mindset, strategize their plan, and effectively study for the Naplex exam. And one of those topics that we always talk about, that everyone always complain about, is test anxiety. Now, test anxiety is really truly a common academic challenge. It affects many people across all diverse educational levels and backgrounds. And it's one of those things where it just happens it just happens. And it's very important to understand the prevalence of it, the root causes of it, and effective strategies to overcome this hurdle and pave the way for your confident exam performance, okay? So, according to the survey by the Anxiety and Depression Association of America, test anxiety affects 16 to 20% of students globally, making it a widespread concern. There are so many high stakes and high stress for it. Students facing those high stake exams, such like our Naplex for pharmacy students, often experience heightened anxiety. The American Test Anxiety Association reports that nearly 25% of students facing major standardized tests struggle with severe test anxiety. And there's always an impact. Having anxiety is a truly impact on your academic performance. Test anxiety has a tangible impact of academic performance. Studies indicate that the students with the highest level of test anxiety may score 12% lower than their peers who are similarly affected. See, it's too prevalent. It's just prevalent. And some of those root causes of anxiety is one of the biggest things of it, the fear of failure. The fear, like every time in when I do a boot camp, I do a Naplex boot camp, and the first one of the first sessions we have is mindset. And in that session, one of majority 90%, actually about 99% of everyone, I don't even gonna say 99, 100%. I don't even think I haven't had a student that says they did not say it, at least. But I'm just gonna say 99% for that reason. Okay. 99% of all the students who every time do this exercise are going to say the fear of failing the exam is one of the number one causes of a lot of things when we do this exercise. And the fear of failing, and it's the fear of failing the exam, it's fear of failing others' expectations, their short-term expectations, whether you are whether self-imposed or external. It's all contributed to the test anxiety. And it's more this being a disappointment to others. That perfectionism is another root cause that always come up for anxiety. Trying to be perfect at all times, striving for that intense perfection. The belief that every answer must be flawless. Any mistake is a failure, set of unrealistic standards, that's all fostering anxiety. That perfectionism spirit. And especially because we're in a profession where it is constantly, I mean, don't get me wrong. It's good value. It's good value. It's like good reasoning for it, but sometimes it's just too much. And it's like if you make a mistake, you can kill somebody. So you're trying to be absolutely perfect that all your I's cross all your T's, because a mistake you can make as a pharmacist can truly kill someone. And it's just constantly drilling you. So you feel you gotta have everything right. And that's something I always tell all my clients. You're not gonna get every answer right on the exam. You're not. And it's okay. I'm sure there's probably someone out there, one some outliner out there that has perfect score, and that's great. But for the majority of people, that's not going to happen, and you may not be that person, and it's totally okay. Because the thing is, as long as things say pass, that's the only thing that matters anyway, right? As long as it say pass, that's all that matters. Okay? Out. That's all. You pass. That's all that matters. Okay? And another cause of anxiety is poor preparation. You just did not prepare well. You had insufficient or ineffective preparation strategies that led to your heightened anxiety. Think about it. Especially when you're in the exam. Like you taking an exam where you like, dang, I ain't even studied. Dang, I remember what was that thing it was. Like, it came like, man, I know it. And you get to go in and thinking like, oh, you just sit there and time like, what was it? What was it? And you just hiding your anxiety. You spend so much time trying to figure out what was that one thing that you saw in your notes you can't really remember, but you're trying to remember. And then it goes to, you're just like, I don't know. And that is exactly one of, like, that's one of the biggest triggers. It's the lack of confidence in your readiness for the exam. It's a key trigger, especially during your test. And you have to say, like, hey, I have to do better. It's one of those key triggers. But those are just some root causes, because I'm going live today. I know, I feel it too. I feel it too. But anywho, I was like, those are some root causes though. Poor preparation, that perfectionism, and that fear of failure. Those are 3 top root causes of your test anxiety. But we didn't dissect that thing. We know the root cause. Now let's figure out what, like, let's give you some strategies. Your roadmap to success. Okay? One of the root causes is poor preparation. So guess what? Because guess what solution strategy is going to be? Effective preparation techniques. Develop a structured study plan that includes ample time for you to review, practice tests, and self-assessment. This is the cornerstone. These are the foundational principles that I have in all my programs, especially the 4 days passing Naplex program. You have to take that time. You have to review. You have to do those practice tests and self-assessment. And I give you so many, but not so many. I give you your true study system, how it goes, how you're going to use the study system to get to the Naplex and pass. Because adequate preparation diminishes uncertainty and builds confidence. I truly remember in pharmacy school, this is how I knew. Let me tell you something. This is how I knew something was up. This is how I knew about that Naplex exam. I'm gonna tell you, it's strange. First semester of pharmacy school, I had read, and this is I mean, it's embarrassing to say, but it's my truth, okay? And first year of pharmacy school, I remember this test I had prepared for. I mean, I studied every single thing, read every single thing, and my grade reflected. But of course, you start procrastinating. I started procrastinating. Things started happening in lifetime. I let stuff slip, and it became a habit of, I never studied everything. I never studied all the topics for any exam until my last year didactic. And my last couple exams, I was in a study group. I just happened to our paths had crossed. And it was the first time doing the study group, my first time I had actually studied every single thing. And again, my grade reflected. I made an A on the exam. I was like, oh wow. So, failed the Naplex once. I'm going to be honest. I studied, but I didn't study everything. The second time I failed the exam, I was like, oh, at that time, I'm about to age myself. At that time, it was actually scored. And even at that time, it was scored and they gave you a threshold. I had failed within points of passing. So I was like, okay. It's fine. And the second time, I was like, I'm just going to study the main topics and let that be there. I'm not going to study every single thing. That was not a good idea. Because I failed again. But that third time, I said, I'm going to study all the things. And I studied all the things. I passed. So, effective preparation techniques are always needed. Second thing, stress management techniques. You have to incorporate stress reducing practices into your routine. Though that mindfulness, I constantly talk about the deep breath exercises when you inflate your belly like a balloon. Exhale those deep breaths. That mindfulness, that 1 minute that 1 minute meditation, you just calm your mind, does wonders, like wonders. Have you have everybody's different, but you have to figure out which technique works for you and implement it. So work on those. Find out which one works for you and incorporate stress management techniques. And here's a tip I tell my clients: when you're in an exam, you stressed out, do that deep breath. Do that deep breath. Take 3 deep breaths. We even have a stress management technique cadence specifically for the exam. When you're in an exam, I want you to do this. We implement all those things. You have to. Third tip, positive self-talk. I talked about it in the previous session. Encourage yourself. Replace those negative thoughts with positive affirmation. State your affirmation that you wrote in that session. Write it down. In the Naplex, they give you time to just go through. When that time comes, I tell all my clients, you use that time in the exam, they tell you to go and get familiarized with the stuff, look for it. But that little extra time you get, you write the notes to yourself and you remember and you encourage yourself. So when that stress comes, you go back and say to that, you read the affirmation, okay? You read it. Fourth thing, we want to break down the test. Sometimes we try to get too much, trying to just study all the things. Break it down into small, manageable sessions. Or smaller, manageable sessions. Tackle one segment at a time. One bite at a time. They always say how was the best way to eat an elephant? One bite at a time. One bite at a time. And my fifth scratch is going to be health style life choices. Make sure you sleep. Because pulling the all-night for the exam is not going to work. Your brain can't function. And then I'm going to tell you just like this, it's even proven studies that shows this. When you take the exam on a pulling an all-nighter, the first half of the exam you're going to do good. The middle part you're getting sleepy, so you really not concentrating and falling off. And the last part you back woke and you got it and you're going to get it right. It's always that middle section that dip in the answer choice you get most of them wrong because that tired brain. Exercise. I don't care if it's something as simple as yoga or stretching. Exercise. I don't care if it's like, hey, I can't exercise, but you got a dog. Walk that dog 3 times a day. That's 10 minutes. That's at least 30 minutes throughout that day. 10 minutes for 3 times is 30 minutes. Okay? Like, do physical activity. Physical activity exercise boosts your memory. It helps your brain. And it also produces those good hormones. Come on now. All those good neurotransmitters that come and go and you feel good. You feel happy. You need that. As well as that diet. Balance that diet. When I tell you, my clients, we have a whole diet. I don't even play with them. We have an entire diet we have to follow. Boost it. Because a healthy lifestyle positively impacts your cognitive function, your emotional well-being, contributing to a resilient mindset. Okay? So task anxiety can be conquered. Follow these 5 strategies. Prepare effectively. Manage that stress. Talk positive to yourself. Break that test down. And have better lifestyle choices. I say healthy lifestyle choices, okay? Because test anxiety is affordable change, but it's conquerable. It's conquerable. You can conquer it. You can do it. It can happen, okay? It really can. So remember, your ability to succeed is not defined by a single test. It's a cultivation, a culmination. Sorry, a culmination of your knowledge, your skills, and your resilience. Embrace the journey, cultivate that positive mindset, unlock your potential beyond the confines of this test anxiety, okay? Now, until next time, remember that pharmacy is on limit if you are. Now go be great.